Chapter 40. Tropical diseases. Most diseases affecting mankind are found in all parts of the world, there being little difference in the way they affect the human body. But some diseases occur more frequently in hot, moist climates. These are the so-called tropical diseases, many of which may also occur in subtropical areas, but usually less frequently. Most of these are in subtropical areas, but usually less frequently. Most of these are transmitted by germs or viruses, but some are carried from one person to another and injected into the human body by the bites of mosquitoes, ticks, ants, spiders, rats, and many other creatures. For easy classification, we are including all of these in this chapter. Malaria. Malaria is one of the most widespread diseases in the world. Hundreds of millions of people are affected by malaria, of which there are three main types: vivax, falciparum, and malariae. Commonly these are called benign tertian, malignant tertian, and quartan respectively. A fourth one, known as ovale, is so rarely seen that it is regarded more or less as a curiosity. One of humanity's greatest scourges, malaria renders many fertile areas of the world virtually uninhabitable. It is transmitted by the Anopheles mosquito. When the female of this particular species bites a patient who has malaria, she draws up a small quantity of blood containing the parasites. These parasites then pass through several stages of development within the mosquito's body, and finally find their way to its salivary glands. There they lie in wait for an opportunity to enter the bloodstream of the next individual the mosquito bites. About 10 days after the mosquito has injected these parasites into a person's bloodstream, many more parasites can be seen under a microscope. Most of them are now within the red blood cells of the victim. There they grow until they eventually replace all the hemoglobin within the cell. Although probably only one parasite. 380 tropical diseases. Attacks any one cell, each continues to multiply until there may be 16 within each cell. As the cell breaks up, these are released. Each tiny parasite then attacks another red cell, thus repeating the cycle every 2 or 3 days. Many of the parasites are destroyed by the defense system of the body, particularly by the white blood cells in the spleen, liver, and bone marrow. But enough of them survive to cause plenty of trouble, as every patient with malaria will testify. Not all strains of malaria parasites are the same. In some parts of the world certain medicines will quickly destroy the parasites, while the same medicines seem to be far less effective in other areas. Typical attack. During an acute attack of malaria, the patient complains of fever, weakness, headache, and chilling sensations similar to those experienced in an attack on influenza. In more severe cases, the attack begins abruptly with shaking, chills, fever, and sweating. Between these paroxysms, the patient usually feels miserable and runs on low-grade fever. The temperature may run to 104 degrees F, and the patient may complain of severe headache, and many manifest drowsiness, delirium, and confusion. This is particularly true of the falciparum type, which is the most serious form of malaria. Blackwater fever rarely occur, but when it does, it usually involves patients who have been treated with quinine or pomoquine. With this serious complication the patient suffers from jaundice, anemia, severe prostration, and shock. But in most cases there is little to fear, for these complications rarely occur. Treatment. Among the best medicines for treating malaria are the newer anti-malaria drugs, particularly chloroquine or amodiaquine. The usual dosage for chloroquine is 1.0 gm to start with, followed by 0.5 gm in 6 hours, then 0.5 gm daily for 2 more days. For the falciparum type of malaria, continue with this dosage for 9 days. Amodiaquine dosage is as follows: 0.6 gm the first day, and 0.4 gm daily for 2 more days. Severely ill patients and those who are vomiting or in a coma, may have to be given medicine by vein along with sterile glucose and saline solution. Vivax malaria is more difficult to cure and relapses occur more frequently. But eventually the disease burns itself out. Primaquine is useful in wiping out the persistent parasites that remain in the blood even after the fever has subsided, the dosage being 15 million guaranis daily for 14 days. Good nursing care is always essential in acute attacks of malaria. Dengue fever 381. As far as possible, the patient should be given plenty of fluids, fresh fruit juices, and a balanced diet. To keep malaria under control, give 1 tablet of chloroquine each week as long as he remains in the area where Anopheles mosquitoes and patients with malaria are known to live. Proper drainage of marshes and swamps, as well as adequate treatment of all known patients will go a long way toward keeping this disease under control. A personal precaution that all should take is to sleep under a mosquito net. Children's beds should especially be screened by nets. Dengue fever. Dengue fever is another common disease of the tropics. It usually begins suddenly with a severe headache, fever, prostration, pains in the joints and muscles. There is severe aching in the lower extremities and the larger joints, such as the knees. Hence the name break-bone. Dengue is caused by a filtrable virus transmitted by the bite of the Aedes aegypti mosquito. During an acute attack, the patient experiences severe pain when moving his eyeballs. The yellow fever 383. Fever rises rapidly to 102 or 104 degrees Fahrenheit. It may last for 2 or 4 days, to be followed by a rapid recovery for about 24 hours, after which may come a second rise in temperature. At this time a rash may appear to the skin. Treatment: keep the patient in bed, give him plenty of fluids, and apply an ice bag to his head. 1 or 2 aspirin tablets every 2 to 3 hours will help control the fever and pain. Keep mosquitoes away from the patient as a precaution against spread of the disease. Yellow fever. Yellow fever is a serious tropical infection found principally in the hot moist tropical areas of Africa and certain parts of Central and South America. It is caused by a filtrable virus which is transmitted by the bite of the female Aedes aegypti mosquito. The disease is referred to as yellow fever because many of the liver cells are damaged or destroyed, causing jaundice or a yellow discoloration of the skin, due to the presence of bile. Most attacks of yellow fever are mild today compared with those recorded in previous generations. The disease begins with a sudden onset of fever, the temperature going to 103 or 103 degrees F, associated with chills. The face is flushed, the eyeballs are reddened, the gums congested, and the tongue red and sore. The upper abdomen is tender and muscles, particularly the calves of the legs, are painful. This condition may be followed by severe prostration, headache, restlessness and irritability. After about 4 days the virus attacks the cells of the liver, and jaundice develops. Small hemorrhages occur in the mucous membranes, and there is bleeding from the gums. During the fever, the patient is mentally dull, confused and apathetic. This condition is not unlike some cases of malaria, relapsing fever, influenza, and dengue, and the disease must be carefully distinguished from these other types of fever. In severe epidemics, 4 out of 5 patients with yellow fever may die. Control: governments in most tropical areas are taking great precaution to prevent the spread of this disease by travelers. Those who have to travel to known yellow fever areas must be vaccinated against the disease. 384 tropical diseases. Treatment: unfortunately, there is no specific treatment for yellow fever. Proper cooling measures, including the use of cold, moist packs, ice bags, or electric fans, will help to lower the fever. Severely ill patients should be treated in hospital where glucose and saline can be given intravenously. Relapsing fever. Relapsing fever, otherwise known as tick fever, is an acute infectious disease transmitted by lice and ticks. It usually begins suddenly with a severe headache, vomiting, muscle and joint pains followed by weakness and fever. The fever usually remains high for several days, then subsides suddenly. The patient may have some jaundice, as well as tenderness over the spleen and liver due to the involvement of these organs. Treatment: during the acute stage, keep the patient in bed. Good nursing care is most important. Nausea and vomiting may be controlled by injections of Dramamine, or similar medications. Injections of penicillin should be given during the first few days, but should be withheld later. The adult dosage is 600,000 units intramuscularly each day for 3 to 5 days. Other antibiotics, such as acromycin, may be used, the dose being 250 mg 3 times a day, taken after meals. Infectious jaundice. Infectious jaundice, or Weil's disease, is caused by a parasite carried by rats. The infection is acquired through food, water, and other materials contaminated by rats. The disease is seen most frequently in miners and wharfmen and in people who live or work where sanitation is improper. The patient usually complains of chills, fever, headache, vomiting, and muscle pain. The temperature may rise to 104 degrees Fahrenheit for several days and then decline to normal. Jaundice appears by the 5th day. Many patients may have albumin, red cells, and bile in their urine. Those who do not develop jaundice almost always recover. Among those who do have jaundice, the mortality rate is low, except in Japan where for some reason there are many more deaths. Prevention: as far as possible, all rats should be exterminated. Typhus and spotted fever 385. Human beings exposed to water in drainage ditches, sewers, and mines always run a great risk. Unfortunately, there is as yet no effective vaccination against this disease. Treatment: good nursing care is important, particularly if there is evidence of jaundice or kidney disease. A reasonable amount of fluids should be given, but the kidneys must not be overloaded. Follow the dietary suggestions outlined for infectious hepatitis on page 328. Keep the patient in bed as long as he has a fever. Penicillin and other antibiotics are useful in treating pneumonia and other conditions that are often associated with infectious jaundice, but unfortunately these valuable medicines have little or no effect upon the spirochetes that cause the disease. If penicillin is used, the dosage is 4 million units a day. Tetracycline, 2 gm a day, may be given if the patient is allergic to penicillin. Typhus and spotted fever. Typhus and spotted fever are caused by tiny organisms known as rickettsias. They are transmitted to man from animals. Typhus is spread through lice and fleas. Rocky Mountain spotted is spread by wood ticks. South American spotted fever is transmitted by dog ticks. The same is true of Mediterranean fever. Q fever, another rickettsial disease, is spread by ticks from cattle, sheep, and goats. Tsuchigamushi disease, which is seen particularly in Eastern Asia and the Pacific areas, is spread by mites and chiggers. Another name for this disease is scrub typhus or Japanese river fever. Because these diseases are all similar in many respects, they are discussed as a group. In most cases the patient feels an abrupt onset of chills, headache, fever, and weakness. There may be pains in the back and legs for several days prior to the onset of fever. The temperature usually remains elevated for at least 2 weeks before returning to normal. Heart action is slow. The patient feels apathetic and has no desire for food. Usually there is a rash within the first day or two. In spotted fever the rash usually begins on the extremities and extends to the trunk. In typhus the rash begins on the chest and back. In severe cases the skin is hot and red, and the patient is delirious and may even suffer from some convulsions. Pneumonia may develop and 386 tropical diseases. Breathing may be rather difficult. Special diagnostic tests, such as the Vay-Felix reaction, may be needed to identify the disease. Treatment: keep the patient in bed as long as he any fever. Give him small, frequent feedings. Be sure he has adequate fluids. The high fever may be reduced by cooling measures, as recommended on page 506. Because of the fever and sweating, the patient should be given extra salt, particularly in hot climates. Severely ill patients are best treated in hospital where oxygen is available. This is particularly important if the patient has pneumonia or heart trouble. 1 or 2 aspirin tablets every 3 hours may help to keep the fever down and to make the patient more comfortable. Terramycin and other broad and spectrum antibiotics are valuable in this disease. The patient should have 2 capsules every 6 hours for the first 3 days, and then 1 capsule every 6 hours for the next week. Keep him in bed until the temperature has been normal for at least 3 days. Filariasis. The term filariasis represents a group of similar disease occurring in certain tropical and subtropical areas of the world. Tiny worms within the lymphatic system and the connective tissues of the body are responsible for this condition. These microscopic worms may also be found in the circulating blood at night. Infection is spread through several species of mosquitoes. As in the case of malaria, the mosquito first becomes infected with the parasites by biting a person who already has the disease. The parasites mature within the body of the mosquitoes, and later migrate to the mouth parts of the insect. Then when the mosquito bites another person, some of these microscopic worms find their way into the bloodstream and finally locate in his body tissues. There, are adult worms, they obstruct the lymphatic circulation, and cause considerable inflammation and scarring. It takes about 8 months from the time the young worms enter the victim's body before the disease is fully manifest. Swellings and redness of the tissues, particularly along the lymphatic channels, are common in this disease. The patient complains of chills, fever, headache and weakness. Elephantiasis occurs when there are exceedingly large swellings in the tissues. In men, scrotum may become enormously enlarged. Elephantiasis only seems to occur in those who Filariasis 387 live a long time in the endemic area and who repeatedly exposed to the infection. Treatment. Unfortunately, there is still no specific treatment for filariasis. If possible, the patient should move to a cooler climate. Diethylcarbamazine can be given 3 times a day, although it may not alter the course of the disease very much. Very large swellings can sometimes be removed by surgery. Swellings in the lower extremities can be treated by elevating the involved leg and using an elastic bandage. The major types of filariasis are these. Loiosis or Calabar swelling. This form of filariasis is found in West Africa and is transmitted by the bite of the chrysops fly. In this particular disease, adult worms migrate under the skin, causing localized swellings. At times they may even migrate across the eyeball under the conjunctiva, causing pain and discomfort to the patient. This form of filariasis responds well to diethylcarbamazine, the dose being 100 mg after breakfast on the first and second day, 300 mg on the third day, 400 million guaranis daily until the 10th day. 388 Tropical diseases. Guinea worm, dracunculiasis, is a type of filariasis found widely in India, the Middle East, tropical Africa, and certain parts of the West Indies. It is also known as the fiery serpent. The female worm tunnels under the skin, especially in the legs and feet, causing blisters which later ulcerate. When the ulcer comes in contact with water, the worm in the wound discharges large numbers of immature larval forms, which are eaten by microscopic water fleas known as cyclops. People drink the infected water, naturally acquire the infection. Many of the victims complains of itching, nausea, vomiting, diarrhea, shortness of breath and dizziness. These symptoms are probably due to an allergic reaction caused by the toxins or poisons put out by the worm. Cellulitis develops around the abscessed area of the skin. Treatment. Some people suffering from guinea worm often manage to extract the entire worm, which grows to 3 feet in length, by winding it on a stick. It usually takes about 2 weeks to do this. These worms may also be removed by surgery. The simple expedient of straining the drinking water through a fine mesh cloth such as muslin, usually keeps one from getting these parasites. Boiled drinking water is free from all disease carriers of every kind. Leishmaniasis. This is a group of conditions resulting from sandfly bites. There are 3 major kinds: Kala azar, Oriental sore, and Espundia. Kala azar is primarily a disease of children. It is found in many areas of the world, particularly in India, China, Africa, the Mediterranean area, and tropical South America. The disease is transmitted by sandfly bites. Through these bites the parasites invade the bloodstream, producing marked enlargement of the spleen and liver, as well as anemia and general emaciation. Many patients complain of chills, sweating, dizziness, headache, as well as vague pains in the muscles, bones, and joints, soreness in the eyes, bleeding from the nose and gums, and distension of the abdomen. Treatment: bed rest is important during the acute stage of the disease. The patient should be given a good diet, and if he is very anemic he may need several blood transfusions. Special care should be taken to keep the mouth and gums clean. Severely ill patients may need penicillin to combat side reactions due to bacterial infection. Sleeping sickness 389. Ethylstabamine, neotibasan, has proved useful in most areas. The first dose is 0.2 gm. Given in a 5% solution in distilled water, followed by 0.3 gm daily until the total dosage of 5 grams is given over a period of about 2.5 weeks. If nausea and vomiting occur, the drug should be given on alternate days, using a lightly smaller dosage. Really sick patients should be under the care of the family physician who can watch for any toxic reactions. Prevention: cracks and dark corners in walls and floors should be sprayed with DDT to keep down the sandflies. Rubbish and vegetation in and around the house should be eliminated. Oriental sore. This form of leishmaniasis is seen in India, China, the Middle East, the Mediterranean area, and tropical Africa. The parasites are carried by sandflies. Several ulcers may occur on exposed areas, especially the face, ears, neck, backs of the hands, and forearms. There may first be a small red spot with intense itching. Later, a scab forms over the area, followed by the development of an ulcer, with clear-cut margins that bleed easily and heal slowly. It usually takes a year or more to clear up this condition. Antibiotics are useful in cutting down bacterial infections around the ulcers. Quinacrine hydrochloride, 10% solution, may be injected locally around the ulcer. Neostim is also useful and worth trying. Sleeping sickness. African sleeping sickness is a chronic disorder arising from the invasion of the body by certain parasites carried by the tsetse fly, Gluzina. The South American form of sleeping sickness is known as Chagas disease. These parasites are similar to the African type, but are carried by the barbaro or assassin bug. The disease in either case is called trypanosomiasis. Patients complain of fever, swellings in the lymph glands, and skin irritation. This is followed by tremors, headache, listlessness, convulsions, and eventually coma and death. Rhodesian trypanosomiasis is more severe and more fatal than the Gambian type. Chagas disease or South American sleeping sickness, more likely to occur in young children. If the disease is severe, they develop fits or convulsive seizures. Milder forms of the disease cause little trouble. In some cases the heart may be involved, as well as brain and the central nervous system. These are always more serious. Prevention: in the African type of sleeping sickness, tsetse flies. 390 tropical diseases must be avoided or excluded from the environment of the family. Further protection may be obtained by injecting 1 gram of suramin, antropol, every 2 to 3 months. Pentamidine may be given by injection every 6 months, the dose varying according to the patient's weight. A person weighing 150 pounds would need 200 million guaranis in Chagas disease. Bed bugs and other vermin that inhabit poorly constructed houses and outbuildings should be excluded by frequent spraying with gamexane, BHC. Dwellings should be made insect-proof to prevent the insects from returning. Treatment: no one should begin treatment for sleeping sickness until the diagnosis has been confirmed by laboratory studies on the blood. The drugs are so potent that there is some risk in using them. Unfortunately, Chagas disease does not seem to respond well to any drug, although primaquine may be of value. 15 mg taken by mouth twice a day for 5 days, and then 15 million guaranis daily for the next 10 days. For African sleeping sickness, suramin sodium should be injected intravenously or intramuscularly. The first dose is 300 million guaranis in 10 cubic centimeters of distilled water, followed by 1.0 gm. Every 4 days for the next 6 weeks. If desired, pentamidine may be given by intramuscular injection, the dose being 2 mg per pound of body weight. This should be mixed with 3 cubic centimeters of sterile water and injected deep in the muscle for a total of 10 injections. In more serious cases where the brain has been penetrated by the parasites, treparcimide is given by intramuscular injection dissolved in 10 cubic centimeters of distilled water. These injections are given once a week of 15 weeks, the first dose being 1.0 gm. And after that 2 to 3 gm per dose. Still another medication, Melb, may be tried. This drug contains arsenic. It should be given intravenously each day. 2.5 cubic centimeters daily for 3 days. Then, after a week's rest, the daily dose is 3 cubic centimeters first day, 4 cubic centimeters second day, and 5 cubic centimeters third day. After another week's rest, 3 daily injections of 5 cubic centimeters each are given in the hope of killing the parasites. All infected animals should be destroyed, otherwise the human population will not be safe. Yaws. Yaws or thromboetia is a tropical disease mainly affecting children. It is transmitted through discharges from skin ulcer, as well as by typhoid and paratyphoid. 391. Body contact, infected clothing, and also by insects. This is not a venereal disease, although in some respects it is similar to syphilis. The first sign of trouble is the mother yaw, which consists of 1 or 2 red, pimple-sized swellings which ulcerate. A generalized skin rash may then develop sometime within the next 2 or 3 months. The patient complains of fever, headache, weakness, and sore joints. Unless properly treated, the last stage of the disease may result in crippling disfiguration of the feet, crab yaws, and also some destruction of the bones. Blood tests for this disease are positive, similar to that of syphilis. Treatment: the drug of choice is penicillin. The patient should be given daily injections, 600,000 units per day for a week. In children the dosage may be lowered, but there is no harm in giving the adult dose, provided the child is not allergic to the drug. If the patient is sensitive to penicillin, try the tetracyclines, such as terramycin, the dosage being 3 tablets a day for 7 days. For advanced cases neoarsphenamine injections may be given, the dose ranging from 600 mg to 900 mg given intravenously once a week for 6 weeks. If the blood test still shows strongly positive, a second course of treatment would be advisable after a few weeks' rest. Great care must be taken not to give inadequate treatment. Good nursing care is essential in this disease, and the patient should be given the benefit of a balanced diet. Typhoid and paratyphoid fever. Although typhoid and paratyphoid fevers are more common in warm tropical area, both of these diseases may occur in other parts of the world. Persons contract typhoid fever from patients who have the disease, or from caries. Poor sanitation is most often responsible, contaminated water being the usual source of infection. The next most frequent cause is infected milk. These sources are likely to be found in cities as well as in rural areas. Other foods may also be responsible. Sometimes certain people, known as carriers, may spread the disease. Many of them are food handlers. In a few cases flies may bring the germs into the house and contaminate the food. Germs enter the body through the mouth, causing irritation and ulceration of the lower small bowel, Peyer's patches. F26. 392 Tropical diseases. It usually takes from 10 days to 2 weeks for the disease to develop. The patient feels chilly, tired, and weak, has a headache and loss of appetite, followed by nose bleeding, backache, and either diarrhea or constipation. Many of these patients also have bronchitis, so that in the early stages of typhoid the disease may appear as pneumonia. The temperature rises and remains high for about 10 days to 2 weeks, then slowly comes down to normal by the end of the 4th week. In untreated cases the pulse rate is slow, and there may be rose-colored spots on the abdomen. During 2nd week the patient may become delirious and stuporous. Serious complications include severe sore throat, nausea and vomiting, abdominal pain, pneumonia, kidney disease, and inflammation of the nervous system. There may be severe bleeding from the intestines and even perforation through one of Peyer's patches. At times the heart may also be involved. This slows recovery. Diagnosis is very important. This disease resembles others for which an entirely different treatment may be needed. During the 1st week typhoid germs are found in the bloodstream. At the end of the 3rd week the germs are also found in the urine. The Whittle agglutination is a useful laboratory test which becomes positive during the 2nd week of the disease. Prevention: make sure all drinking water is either boiled or thoroughly purified. Milk should be pasteurized or boiled. People who handle food should be carefully screened to be sure they are not carrying the germs of typhoid or paratyphoid. People traveling abroad should be given the triple vaccine for protection against typhoid fever. The dosage for an adult is 0.5 cubic centimeters the 1st week, 1 cubic centimeter the 2nd, and 1 cubic centimeter the 3rd week. This should be given just under the skin. A booster shot every year is also advised in areas where the disease is endemic. Treatment: chloramphenicol, chloramycin, is the best drug. The adult dose is 1 250 million Guaranese capsule 4 times a day after meals and at bedtime. Young children should be given 100 milligrams after meals and at bedtime. The medicine should be taken for 2 or 3 weeks, according to the condition of the patient. Good nursing care is highly important in this disease. All members of the family should be given the vaccine to minimize any further spread of the infection. The patient should also be given plenty of fluids and a light general. 394 Tropical diseases. Diet without any roughage or spices. Many physicians recommend a diet consisting entirely of liquids, milk, congee, soup, fruit juice, given in 8-ounce amounts every 2 hours. This diet should continue for 1 week after fever has disappeared, and then the patient should gradually return to a general diet over a period of several days. The mouth and teeth should be kept clean. If the mouth is dry, give the patient chewing gum to encourage the flow of saliva. The skin should be kept clean and dry, and the patient given cooling sponges 2 or 3 times a day to reduce the fever. He should be turned frequently from side to side, and also given active leg and arm exercises to prevent complications in the veins. Severely ill patients will benefit from injections of ACTH or cortisone. Patients complaining of headaches should be given the benefit of ice pack. See page 100. Be careful in using aspirin because of complications that may follow. For nerve pain, give 1 5-gr. tablet with milk every few hours. If diarrhea is troublesome, try paregoric, 1 teaspoonful every 2 hours, or some simple medication, such as Pectocab, until the diarrhea is controlled. Severely ill patients should be kept in bed for at least a week or 10 days after the illness appears to have subsided. Antibiotic therapy, such as chloramycin, greatly shortens the duration of the disease, but it does not do away with the need for good, sensible nursing care. Although paratyphoid is a less dangerous disease, the same treatment should be given as for typhoid. Cholera. Cholera is a very serious infection involving the lower part of the smell bowel. It is caused by a short, curved, rod-shaped germ which produces a powerful poison or endotoxin. The disease is spread mostly by contaminated food or water, and by feces and flies. It is found principally in South and Southeast Asia, although it may occur in other areas of the world. One of the most striking outbreaks occurred in London about 100 years ago. The tragic experience of a contaminated well in the middle of London actually gave birth to much of our modern public health programs around the world today. Patients with cholera may first notice a mild diarrhea. This is followed by sudden violent purging and a lack of proper control of cholera prevention and treatment. 395. The bowel. There is a feeling of oppression and pain in the lower abdomen, followed by muscle spasms like heat cramps. The stools are loose, watery, and grayish-brown in color. Nausea and vomiting usually come on after diarrhea has developed. All this sudden loss of fluid caused severe dehydration, and soon the patient begins to suffer from intense thirst. His tongue is white and dry. His skin is wrinkled, the eyeballs sunken, cheeks hollow, and breathing is somewhat labored and difficult. Because of the lack of fluids in the body, the blood pressure falls, and the temperature may even be subnormal, although the pulse rate will be rapid. Unless the fluid is quickly replaced, death may result from complete collapse of the circulation. With proper treatment, the patient usually begins to recover about the third day of illness. Vomiting gradually ceases, and the stools become more normal. Temperature may rise to 103 degrees F, the pulse rate falls, and pain begins to disappear from the abdomen. A correct diagnosis is most important in cholera, for its treatment is different from that of other conditions it may resemble. Prevention. Cholera can be controlled only by rigid purification of water supplies and proper disposal of human wastes. Cholera vaccine is useful for those who live in endemic areas or who have to travel through these areas. Booster injections should be given every 6 months to any who may be exposed to the disease. Other necessary precautions against cholera include avoiding all uncooked vegetables, thorough washing of hands by all who handle food, and the elimination of all contacts with the disease. One should insist on good general hygiene and constant vigilance on the part of all concerned. Good health is everyone's problem, particularly in areas where cholera exists. Treatment. It is important to combat dehydration and restore the circulation of fluid in the body. For this purpose, intravenous fluids are essential. The patient should be given at least 3,000 cubic centimeters of fluid by vein every day, as long as the severe vomiting and diarrhea continue. In addition, he may have ice chips by mouth or sips of water frequently, provided this does not increase the tendency to vomiting. Measure the amount of urine passed by the patient each day. If this amounts to several pints, his chances of recovery are better, but blood transfusions are sometimes needed in seriously ill patients. When the vomiting is less severe, give the patient warm tea. 396 Tropical diseases. And liquid food, but not solid foods for at least another 24 hours. Chloramycidin, chloramphenicol, and the tetracyclines, such as terramycin, have proved valuable in treating cholera. Very ill patients should be given ACTH or cortisone by injection to help combat tachycardia and restore the normal chemical balance of the body as soon as possible. Dysentery. Bacillary dysentery is a distressing ailment in which the patient suffers from frequent stools containing blood. This is an entirely different disease from amoebic dysentery. It is caused by certain germs of the Shigella group, of which there are several varieties. These organisms are spread from one person to another by contact, as well as through contaminated food and water. The disease may also be spread by flies. Epidemics of dysentery usually occur in overcrowded areas where there is no adequate sanitation. Bacillary dysentery is common in younger children. The germs pass directly into the digestive organs, causing swelling and superficial ulcerations. The inflammation in severe cases may involve all of the colon and also the lower part of the small bowel. The disease usually strikes suddenly about 2 days after exposure to the germs, especially in children. Fever, irritability, drowsiness, lack of appetite, nausea and vomiting, diarrhea, abdominal pain and distension, and straining at the stool are all part of the picture. 2 or 3 days later, blood, pus, and mucus appear in the discharges from the bowel, and the patient may have 20 or 30 loose stools a day. All this sudden loss of fluid causes marked dehydration. Delirium, convulsions, and coma may occur in the more serious and severe infections, and unless properly treated, the child may die within the first day or two. In adults the infection is usually less severe, but there may be griping abdominal pain and blood-streaked stools. Straining at the stool may produce prolapse of the rectum. This form of dysentery may resemble cholera, with rice water stools. The disease may even seem like appendicitis and other acute conditions of the abdomen, such as sprue, amoebiasis, intestinal parasites, and ulcerative colitis. Prevention: good sanitation is important. Eliminate all flies and screen all windows and doors to keep out flies and mosquitoes. Pro. Kwashiorkor 397. Protect your food from contamination. Boil drinking water. Insist that all members of your household wash their hands before handling food. Without proper treatment, the death rate is high in infants and young children. Even with adults this disease is serious. Treatment: younger children suffering from dysentery should be treated in hospital if possible, where intravenous therapy can be given. All patients should be kept on liquid diet for the first 24 hours, and also given weak tea. Junket or plain curds, which provide both calcium and protein, are well tolerated and easily absorbed. A soft, bland diet should be given as soon as the stools are more normal. Avoid chilies, spices, and other irritating substances. The most useful medicines are chloramycin, chloramphenicol, and the tetracyclines, such as terramycin or acromycin. The dosage for any of these is 1/250 million Guaranese capsule 3 times a day. Paregoric, 1/2 to 1 teaspoonful every few hours, may help to control the diarrhea and prevent straining at the stool. Tincture of belladonna, 10 drops by mouth 4 times a day, will also help to control the griping pains in the abdomen. Young children should be given 3 drops 4 times a day. Hot, moist packs as suggested on page 96 will also help to relieve the abdominal discomfort and pain. If these are not available, try a hot water bag, but remember to give plenty of fluids by mouth to combat dehydration and shock. Kwashiorkor. Kwashiorkor is a serious deficiency disease arising from malnutrition in late infancy and childhood. It is widely prevalent in those parts of the world children eat large amounts of starchy food, without an adequate amount of animal or vegetable protein in the diet. There is a complete interrelationship between vitamins and amino acids, and when these are missing the child becomes desperately ill. Growth is retarded, the limbs are swollen, the hair becomes reddish-brown instead of black, and the child becomes petulant, apathetic, and often suffers from diarrhea. Some of the trouble seems to stem from fatty infiltration of the liver. The pancreas becomes atrophied. Skin infections are common, and there is often a loss of pigment associated with weakness and anemia. Treatment: seriously ill infants are best treated with skim milk in small quantities given at frequent intervals. Gradually the 398 tropical diseases. Amount of cream in the milk can be increased. Small frequent feedings in the early stages are tolerated best. Multiple vitamins should also be added to the diet. Infections should be treated with suitable antibiotics, such as penicillin or terramycin. The child may also be suffering from malaria or some other parasitic infection and should be given treatment for these. With good nursing care most children will make a satisfactory recovery. Undulant fever. Undulant fever, also known as brucellosis or Malta fever, is seen in many parts of the world. It is always more prevalent in rural areas, particularly among people who work with cattle and other livestock. There are 3 different kinds of undulant fever. Undulant and rabbit fevers 399. One is carried by cattle, another by pigs, and a third type by goats. All 3 types react in a similar manner. The disease usually begins suddenly with chills, fever, severe headache, muscle pains, and general weakness. At times the onset is more insidious, with a moderate temperature in the evening which gradually drops back to normal by morning, followed by profuse sweating. The patient may complain of poor appetite, with weight loss, abdominal pain, joint pain, backache, irritability, and depression. Unfortunately, it is not always easy to arrive at the correct diagnosis, for there is no single test that is 100% reliable. Undulant fever may resemble typhoid, malaria, influenza, and even tuberculosis at times. Prevention: undulant fever germs are often present in milk and other dairy products, such as butter and cheese, that have not been boiled or pasteurized. The disease can usually be prevented by boiling all milk or by proper pasteurization. Gloves should be worn when handling animals suspected of having brucellosis. Treatment: keep the patient in bed during the acute stage of the disease. Some mild pain-relieving medicine, such as aspirin, will help to alleviate pain and headache, and also to lower the temperature. Give 3 or 4 capsules of terramycin, and also inject 0.5 gm of streptomycin daily as needed. Severely ill patients should be given ACTH during the critical time, or one of the cortisone products, such as prednisolone. Good nursing care shortens the duration of the illness and is always most important in making a good recovery. Tularemia. Rabbit fever. Tularemia is another highly infectious disease. It is carried by wild rabbits and other rodents. The disease is transmitted from one animals to another through ticks and other vermin. Hunters, butchers, farmers, fur handlers, and laboratory workers are most commonly infected with this malady. Those who eat inadequately cooked rabbit meat run a great risk of developing the disease. Ulcerated areas may appear on the skin and in other parts of the body, such as round the eyes and lymph glands. The disease begins suddenly with headache, chills, nausea, vomiting, and severe 400 tropical diseases. Prostration. After a few days a typhoid-like state frequently occurs, and the patient may develop pneumonia and inflammation of the spleen. Prevention: people who handle rodents and wild animals should treat them with great caution and wear protective clothing and gloves. Germs of tularemia may not only be present in the animal's body, but there may be infected ticks and other vermin in the fur. Those who use wild birds and game animals for food should be sure the meat is thoroughly cooked before eating it. Treatment: inject 1.0 gm of streptomycin intramuscularly every day. Also give 2 capsules of chloromycin every 6 hours until the temperature is normal, and then 1 capsule 3 times a day for the next 7 days. Good nursing care and adequate fluids are very important in this disease. Moist, wet dressings should be laid over the ulcers in the skin. A heating cradle, as described in the appendix, will relieve the discomfort of the ulcers. Plague. Bubonic plague is one of the most serious disease ever to have hit the human race. In the Middle Ages, untold millions of people, some of your ancestors and mine among them, died from this dreadful malady. Almost the entire world was overrun by this disease, which is carried mainly by rates and fleas. Though other animals carry the germs causing the plague, man is less likely to come into contact with them from those sources. This is how the disease is spread. Infected fleas will leave a dead or dying rat or other animal and jump on the next living creature that comes near, depositing the infected material on the victim's skin. When human beings contract the disease, they usually develop pneumonia and spread the disease to still others by droplet infection. This is the epidemic form of plague. In the bubonic form, which is the more common type, the patient complains of chills, followed by a rapidly rising temperature up to 103 degrees F, later going up to 106 degrees Fahrenheit. There is an anxious expression on the face. Soon the victim complains of vomiting, thirst, and pains all over the body. His head aches and he feels mentally dull. His skin is knot and dry, his face is bloated, and his eyes red. His hearing may be impaired, and he may even have convulsions, stupor, and coma. Plague prevention 401. Black spots may appear on the skin. It was this that gave rise to the term Black Death during the great epidemics of the Middle Ages. During the first few days of the disease, the lymph nodes become large and tender and are called buboes. Many unfortunate victims of the malady develop pneumonia, followed by severe heart failure. In untreated cases, the outlook is poor, the mortality rate going up to 90% or in some epidemics. Treatment: patients with bubonic plague should be treated in hospital under strict isolation techniques. Streptomycin is the drug of choice. 0.5 gm being injected every 3 to 4 hours intramuscularly. Chloramphenicol, chloramycidin, should also be given, 2 capsules every 3 to 4 hours. Prevention: prevention depends upon the control of rats and fleas. Eliminate all rubbish around the house. DDT sprays can be used to help eliminate fleas and other vermin. Good health for the family